with us right now.
Mike, go ahead, please.
Yeah, you bet. Well, we've spoken a lot about masks this morning, but the President's also given the task force a priority of assessing the availability and expanding the availability of ventilators. And on Monday, we will detail some very encouraging news for Americans. You speak about the number of 13,000. It is a little more than that we have in the national stockpile. But it's important to remember that that doesn't include the more than 100,000 ventilators that are in healthcare facilities and hospitals around America today. It doesn't include what will be produced, as the President said. We're seeing companies step forward. These manufacturers tell us that a ventilator actually isn't a very complicated piece of equipment, and many of them are literally surging forward to create more ventilators. But one of the more exciting developments in the last week, which we'll detail more on Monday, is that in the President's engagement with our healthcare community, we learned that ventilators that are currently used by anesthesiologists, that are used in outpatient clinics and in other procedures, can be converted to be used as ventilators for people struggling with the effects of the coronavirus. We've confirmed that a particular screen in that device can be changed readily. We're working with the FDA to approve that. But again, it's a great testament of the American people and our healthcare professionals that are stepping forward and bringing ideas forward that literally, as we'll document Monday, will increase the supply of ventilators by tens of thousands. But look, the President's made it clear. We want to make sure that all the incredible, courageous men and women who are serving in healthcare around America have the support they need, that our patients that are struggling with recovering from coronavirus have the equipment they need. And we'll have a lot of detail on Monday as we continue to assess
days ago that
what's
we would have
available.
1.4 million tests on board by the end of this week, by today. Do we have that? Can you give us the number that we have?
Let me let Admiral Guo speak to that.
Thank you.
So I'm going to answer your question and then try to persuade you to stop asking about a specific number, okay? So from March 2nd to March 14th, we have put over 10 million laboratory tests into the U.S. commercial market, and we expect that by March 28th to be well over 27 million into the market. So that answers your question, and let me tell you why it's not the right question. Not every lab can run every test. Not every test is completely self-contained. So the more important question is not how many tests are in the market. We got them in the market. But is to make sure that every segment of the market has the kind of test that they can use.
Admiral, we're using your numbers trying to find out for the public if the things you've promised are happening.
Yes, they are happening. They are. We promised 1 or 4 million. There's 10 million tests in the market now.
And are the masks that are in the strategic reserve being deployed, Mr. Vice President?
Yes, the masks in the strategic national stockpile.
So it's not 13,000 anymore. It would be a lower number. Would that be fair to say?
Masks or
the ventilators. I'm sorry, the respirators. Thank you. We're trying to understand if the things we have been told sitting through these briefings for many days are happening and getting into the hands of the healthcare providers.
You understand it. You understand it. You're an intelligent woman, Kelly. You understand exactly what he's saying. And what he's saying is rather incredible because we inherited an obsolete, broken system. And when you hear the number of tests that we'll be providing and are now, it's incredible. And I've heard a lot of governors say the same thing. We took over an obsolete, broken testing system that wouldn't have worked for even a small problem, let alone one of the biggest pandemics in history. And what these gentlemen have done is incredible. I am going now to negotiate a great deal for our workers and our citizens. I'll be back tomorrow. We're probably doing this tomorrow. And if I might, I'd like to ask Vice President Pence to take over. And thank you all very much.
Thank you, Mr. President.
Mr. Vice President.
Thank you all.
Sorry, Mr. President.
How about back here?
Mr. Vice President, the military has sent planes to Honduras, Morocco, and Peru to pick up Americans and bring them home who have been stranded there. But there's still a lot of other Americans who are stranded and can't get home. So does the military plan to send planes to pick those folks up? Where will those planes be going? When will they be going? And can you assure Americans that who are stranded in foreign countries that they will be able to get home?
Well, we received a briefing this morning from the State Department about their efforts. And we want to be very clear. While the President has suspended all travel from Europe, including the UK and Ireland, suspended all travel, of course, from China since January, that any American who can get home can come home. They'll go through additional screening that's all been implemented and is working in an orderly way at a number of airports around the country. But there are instances, Morocco being among them, where there simply are not flights to get home. Our State Department has been working very closely with our embassies in those relevant countries. I was told this morning that all the way going back to bringing Americans back from China, that we have made individual efforts to bring home about 3,000 Americans. I think there is an ongoing effort to address that with chartered commercial flights that the government is providing. Obviously, also military transport is available, but our task force received a briefing this morning, and we would just encourage any American that's looking on from overseas, contact the local U.S. Embassy, let them know about your circumstances, and know that we're going to continue to work very diligently to get our Americans home.
All right, guys, last question. Two quick ones, education and a medication one. You guys have announced that standardized testing is essentially canceled in this country. To the tens of millions of students out there, their teachers and their parents who are sort of scratching their head wondering, well, what does that mean? Obviously, a lot of this is driven by local school districts, by the state. Is there any federal guidance on this? And if not today, could you have Secretary DeVos or somebody come and explain that to the millions who are literally sitting at home trying to figure out what exactly that means?
Well, I think it's a terrific question. And we will bring Secretary Betsy DeVos here tomorrow or on Monday to address our efforts. The objective here was as people are embracing the President's 15 days to slow the spread, we have decisions by local school boards and local and state officials that have canceled school or suspended school for a time. And we wanted the Federal Department of Education to make it clear that the burden of standardizing testing, which back in my days as governor, I remember takes a number of days and sometimes up to a week to administer, is not going to be placed on schools. But we'll have the Secretary here to address that very specifically, and it's a very good point on your part.
I mentioned I had a medication question, and I wanted to ask it while the President was here, because earlier he tweeted that there were two certain medications that, when taken together, quote, have a real chance to be one of the biggest game changers in the history of medicine, and that they should be, quote, put in use immediately. Since he's not here, I can't ask him what he meant, but I'm wondering if Dr. Fauci or the Admiral could clarify if you have any sense of what he was talking about, and whether his 74.5 million Twitter followers should be taking medical advice from him or from someone else.
The President brought together the top pharmaceutical companies in America and in the world a number of weeks ago, and they formed a consortium to work on a range of responses, beginning with therapeutics, which for a layman like me, that just means medicine to make you feel better. They're already going to work on that. We actually think, Dr. Fauci, I think there's some sense that our great pharmaceutical companies may actually be producing therapeutics that will give relief to Americans struggling with coronavirus as soon as this spring. We also challenge them to work together as rapidly as possible to develop a vaccine going forward. And as Dr. Fauci has indicated, we brought a vaccine to clinical trials now the better part of a week ago, the fastest time in history. Now, it's the first phase of the trials, and people should understand, as our health experts have described, that there'll be a period of as much as a year and a half before we can make those vaccines available. But as the President said at this podium, there is some anecdotal evidence that several existing medicines may have brought relief to patients struggling in China and in Europe. And the president has tasked the FDA to work very rapidly to allow what's called off-label use for those. One is a malaria medicine. But this morning, I think the president reiterated the hopefulness that he feels about this, that because these are medications that are time-honored and tested, they've been taken for many, many years, that we want to pursue, number one, making those available if someone's doctor believes that it's appropriate. The doctor would be able to prescribe that medicine even though that's not indicated. That's called an off-label use. But the other piece is, as Dr. Fauci said, and I'll yield to him, in deploying those medicines, we're working specifically with one state to do so in a way that represents a clinical trial. So it would not just be compassionate use, which the medicines are already being used for in some jurisdictions today, but also we could study it and determine the viability of it. And in fact, we're working diligently right now with that supply chain to make sure that those medicines are available. Dr. Fauci, did you want to speak to that? Sure.
You know, it's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop Denovo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. I've got to do my job as a scientist, and others have other things to do.
Great.
Mr. Vice President, question for Dr. Carson? Yeah, question for Dr.
Let me just, if I may, let me just say, I hope this morning has been informative. We will be back again tomorrow. And I hope the American people are encouraged because of the incredible whole-of-government approach, because of our collaboration with states. You're seeing testing expanded all across the country. That incredible public-private partnership with commercial labs is now making testing available by the tens of thousands. We're working very diligently with an incredible response from American industry to make sure that personal protective equipment, and ventilators, and all the things that our healthcare providers need to meet this moment is there. But let me just say again what every American can do today. And that is, first and foremost, heed your state and local authorities. There are individual states, California, Washington State, and at this moment, especially New York, that have issued guidance to their citizens. And as the president said, we wholly support the leadership that those governors are providing in their states. But secondly, every single American can put into practice the principles of our 15 days to slow the spread. The president's coronavirus guidelines, as I said, we're 6 days in, and the purpose of these is not because every American is at risk of serious illness. As we said before, All our experts tell us, all the data shows, that the risk of serious illness to the average American remains low. But because the coronavirus is, we think, 3 times more contagious than the flu, to slow the spread, to literally lower that curve and spare Americans around our country with being exposed to or contracting the coronavirus, or worse, every single one of us can put these principles into practice. I recommend that you go to coronavirus.gov, sit your family down, call a neighbor and a friend, support efforts in your local community to put these principles into practice. And as people all across this country continue to do just that, I just know we'll get through this, and we'll get through this together. Thank you all.
Will there be a briefing tomorrow, sir?
We'll be back here. Thank you, Mr. President.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you.